Here is a comprehensive drug profile for ceftazidime. 1. Generic name, drug class, brand name. Generic name, ceftazidime. Drug class, third generation cephalosporin antibiotic. Brand names, Fortaz, Tazicef, Avinza, Ceftaz. What is ceftazidime? Ceftazidime is a broad-spectrum antibiotic used to treat a wide variety of bacterial infections, especially gram-negative bacteria, including Pseudomonas aeruginosa. It works by inhibiting bacterial cell wall synthesis, leading to bacterial death. Fact 3. Indications, uses. Ceftazidime is used to treat respiratory tract infections, e.g. pneumonia, urinary tract infections, skin and soft tissue infections, bone and joint infections, intra-abdominal infections, meningitis caused by susceptible bacteria, septicemia, infections in immunocompromised patients, e.g. neutropenic patients. 4. Contraindications. Known hypersensitivity or allergy to ceftazidime or other cephalosporins. Anaphylactic reaction to penicillins, cross-sensitivity possible. Number 5. Before taking this medicine, precautions. Inform your doctor if you have a history of allergies to antibiotics, particularly penicillins or other beta-lactams. Discuss any history of kidney disease, gastrointestinal issues like colitis, or seizure disorders. Tell your doctor if you are pregnant or breastfeeding. Use with caution in elderly patients or those with renal impairment. 6. How to use. Ceftazidime is usually given intravenously IV or intramuscularly by a healthcare professional. It is typically administered in a hospital or clinic setting. Follow the dosing schedule strictly. Do not self-administer unless trained. Dosing information. Typical adult dosage. General infections, 1 to 2 gram IV every 8 to 12 hours. Severe infections, e.g. pseudomonal infections, 2 gram IV every 8 hours. Meningitis, 2 gram IV every 8 hours. Renal impairment, dose adjustment required based on creatinine clearance, CRCL. Note, dosing may vary in children and must be prescribed by a physician. 8. Missed dose, overdose. Missed dose, contact your healthcare provider immediately. Do not double the next dose. Overdose may cause neurotoxicity, e.g. seizures, confusion. Seek emergency medical help. Stop or avoid taking if you develop signs of an allergic reaction, rash, itching, swelling, severe dizziness, trouble breathing. There are signs of Clostridium difficile associated diarrhea, persistent watery or bloody stools. Neurological symptoms, e.g. confusion, hallucinations, appear in renal compromised patients. 10. Side effects common: pain, redness or swelling at injection site, diarrhea, nausea or vomiting. Serious: allergic reactions, anaphylaxis, seizures, especially in renal impairment, Clostridioides difficile associated diarrhea, hepatic enzyme elevation, hematologic changes, e.g. leukopenia, thrombocytopenia. 11. Other drugs that will affect ceftazidime. Aminoglycosides, e.g. gentamicin, may increase risk of nephrotoxicity. Diuretics, e.g. furosemide, may increase risk of kidney damage. Probenecid may increase ceftazidime levels by reducing renal excretion. Oral contraceptives may have reduced effectiveness. Thank you. Have a nice day.